आज हम ब्लड प्रेशर के बारे में बात करेंगे। सबसे पहले इंट्रोडक्शन सुने। ब्लड प्रेशर आईडी इज प्रेशर एक्सटेंडेड बाय वुड ऑन द वॉल ऑफ ब्लड वेसल्स। Blood pressure may be also defined as the arterial blood pressure, which is the force excreted by circulation blood on the walls of systemic arteries. सबसे पहले systolic blood pressure. This is the maximum pressure exerted by blood on the wall of blood vessel, which is developed and the peak of the ventricular systole. Systolic blood pressure 120 mm per Hg. Diastolic blood pressure. This is the minimum pressure exerted by blood on the wall of blood vessels during ventricular diastole. Measurement of blood pressure. Blood pressure is measured clinically with sphygmomanometer, which is either of mercury or NRI type. Advise the patient for at least 15 to 20 minutes. The patient should be in the sitting or lying position. There are two methods for tracking blood pressure: placentary method, escalator method. फिजियोलॉजिकल वेरिएशन ऑफ ब्लड प्रेशर। अब हम एज के बारे में बात करेंगे कि किस एज में कितनी ब्लड प्रेशर होती है। चाइल्डहुड में 90 to 120 mm per Hg, एडल्ट पेशेंट में 110 to 120 mm per Hg नॉर्मल होती है, और एडल्ट्री में 140 to 150 mm per Hg। Before the occurrence of menopause in female, both the systolic and diastolic blood pressure are slightly lower than males. After menopause, blood pressure may be slightly higher than the males of the same. Obese persons tend to have higher blood pressure. Resting condition in sleep, blood pressure is decreased. Light exercise such as walking increase the systolic blood pressure but decrease the diastolic blood pressure. Severe exercise, the systolic pressure may be rise up 180 mm per Hg. Regulation or control of blood pressure. The following factors affect and regulate the blood pressure. As we know that blood pressure, cardiac x peripheral resistance, cardiac output, stroke volume x heart rate. Regulation or control of blood pressure. The following factors affect and regulate the blood pressure. As we know that blood pressure, cardiac x peripheral resistance, cardiac output, stroke volume x heart rate.